الدكتور رانديب والدكتور صالح. عملية كانت نوعا ما صعبة ومعقدة وما اكتشف الخلل إلا الدكتور رانديب، والحمد لله والشكر كملت العملية بنجاح وآلام كلش خفيفة وإن شاء الله من أحسن إلى أحسن.
السلام عليكم. دكتور صالح، تسويق الطبي بالهند. ويانا الأستاذ أحمد جاء من العراق بعد 3 عمليات. العملية الأولى لقص المعدة، ثم هناك كان تسريب، وفيما بعد سوى عملية شبكة وما نجحت بالعراق. اجى هنا واستشارنا الدكتور رانديب، وكان رأي الدكتور رانديب مختلف، وأجرنا عملية تغيير مسار وكانت ناجحة الحمد لله 100%. وهسه ويانا الأستاذ أحمد اليوم الرابع والخامس بعد العملية ووضعه الصحي ممتاز.
Thank you. So Mr. Ahmed, he came to us about a week back. He had undergone a laparoscopic sleeve gastrectomy for weight loss in Iraq. He had a leak right after the surgery, and he underwent another exploration within 1 to 2 days. Thereafter, he lost a lot of weight, but he started having a lot of reflux issues. He had a lot of GERD symptoms, for which he underwent another surgery, and this time it was an open surgical procedure where they did a crural repair. Now, we all know that a crural repair after a sleeve would not solve the reflux issues. He was put on proton pump inhibitors, but he continued to have these reflux problems in spite of the fact that he was taking the PPIs. That is when he came to us, and we discussed this with the family, with him and his family and Dr. Saleh, and we agreed that he should undergo Roux-en-Y Gastric Bypass. So he underwent, we converted his sleeve to a Roux-en-Y Gastric Bypass 6 days back. He's doing absolutely fine after the surgery. We discharged him in about 2 days, and today when he's come for a follow-up, he's much better